Rwanda is known as the land of 1,000 hills. And in this rough and rugged terrain, people often walk long distances to reach the nearest health facility. Evidence shows that in these cases, people seek care later and less often. Consequently, preventable and treatable illnesses can become life-threatening. One Family Health is working to change this. Through an innovative business franchise model, One Family Health is bringing affordable, quality care to rural communities. We recruit qualified nurses and empower them to own and operate franchised health clinics called health posts. What's truly unique about our model is our public-private partnership with the government of Rwanda. Through this partnership, our nurses can claim reimbursement from the National Health Insurance Program. Through this partnership, our network is integrated into the public system and co-branded with the Ministry of Health. Operating in Rwanda since 2012, One Family Health is currently supporting 110 nurse franchisees operating across Rwanda. 60% of whom, oh dear, 60% of whom are women. We've served more than 10% of the population, and every day 3,000 patients access care from a One Family Health post. I'd like to tell you a story about one of these clinics. We're so proud of the work that our franchisees are doing for their communities, but the path to get here, like most in Rwanda, has been bumpy. To open a new health post, One Family Health works with government partners to identify the communities most in need of services. These are typically rural communities located furthest from the public health facilities. We also ask the government to provide the physical space for the clinic to ensure their commitment and support for the local health facility. In October of 2013, One Family Health opened our 45th health post in a village called Nyiragasaruba in the Chikumbi district. Nyiragasaruba is a small village in a hilly region of the country, located about 4 kilometers from the nearest health center. But in this rural terrain, that translates to a really difficult walk of 90 minutes or more. The franchisee's name was Mrs. Odette Mukakarara. Odette was 59 years old at the time, a mother of children now grown, recently retired from working as a nurse in the public sector. She was drawn to the idea of being independent and owning her own business. Odette made a down payment and accessed a low-interest loan from One Family Health to cover her startup costs. Her clinic was located in 2 rooms on the premises of the local school. Authorities intended that the clinic would serve the school children and their families. And like most of our clinics, Odette was serving patients with the most common causes of illness, such as respiratory infections, diarrheal disease, and malaria. But patient traffic was really slow, and she saw only 4 to 5 patients a day. Our field supervisor started working closely with Odette to review and help to build her business, to promote her services in the community. But a year later, things really hadn't improved. One Family Health ultimately determined that the location was a problem. We hadn't done enough to validate the government's recommendation of this site. It turned out that the community, the size of the population, was smaller than anticipated, and the local terrain was actually relatively urbanized. Families could catch a bus to the local health facility, which offers a wider range of services. So we began the delicate and difficult process of relocation. The first challenge with relocation is engaging with the government to explain the need and to find a solution that will not leave a community without services. In this case, the biggest challenge was explaining the need for relocation. We had done a lot of work to build trust with the government, to explain to them why they should trust One Family Health to run their clinic. And so delivering the message that the clinic was not sufficiently profitable is a really delicate one to deliver. But the reality is that operating profitable clinics is the way that we can reach the largest number of people. The second challenge is working with our funders. The implications for the budget, the revisions to the timeline, the shift in our long-term path towards financial sustainability. Supporting Odette to relocate required a substantial amount of staff time and additional renovation costs and startup costs in the new facility. Without the commitment and flexibility of funders who really understand the challenges that we're facing and the need to revise and adjust plans, we would not have been able to support Odette to relocate. That's why we're deeply grateful for the flexibility and commitment that we feel from funders like Jenny at the Pfizer Foundation, who make it possible for us to talk about the challenges we're facing and therefore to face them head on.
Great. Thanks, Lila. Can you guys hear me? Okay. And I'm so thrilled to be up here to spend a few minutes to share stories like Odette's and talk a little bit about the Pfizer Foundation Global Health Innovation Grants and the role that they've played in helping her succeed. At Pfizer, our purpose is all about supporting breakthroughs that have the potential to change patients' lives. And as a company that discovers and develops medicines, we clearly understand the potential role that our products have in changing patients' lives. But just as critical is an understanding about the role of innovation and the need to explore innovation in healthcare delivery to make sure that access to quality healthcare is a reality for all of the patients who need it. And it's with that spirit that we launched the Global Health Innovation Grants, or GIG, as we have not so cleverly nicknamed it, in 2015 with the goal of supporting innovation in healthcare delivery and working directly with social enterprises and social entrepreneurs to build and strengthen healthcare systems. We're in our third cohort of GIG, working with 20 organizations spread across 13 countries in Asia, Africa, and Latin America. And we've been lucky to work with Innovations in Healthcare, who you'll hear from in a few minutes, since the inception of that program, to really better understand what the financial and operational landscape is for health innovators, and design a program that was directly supportive of some of the key issues they face, particularly around flexibility and funding, operational support, and the importance of evaluation that's designed to drive impact. So I like that the conference themes here today are tenacity, interdependence, and resiliency because, I think they're really exciting ideas, but also because they really align well to some of the things that we've learned through our 3 years with GIG. After hearing Lila's story and hearing the work of One Family Health, it's probably no surprise that tenacity is a characteristic shared by all of our GIG grantees and really social innovators everywhere. And it's their focus on relentlessly trying to serve the communities that they want to reach, not giving up when they're faced with obstacles, that is so celebrated in this program, and I'm proud to be able to stand with them on their journey. I also just wanted to touch on resiliency because I think it's such an important part of the global health discussion these days, but also really encapsulates what we're trying to do through our program. GIG, in its essence, is a learning portfolio designed to test hypotheses, document results, and share those learnings. And it's really critical that each of us be able to share those learnings in a safe and open space. And so one of the things that we've been really excited about is the trust that's been built between all of the partners who are now sharing their challenges as freely as we share successes. And then just on the last note about flexibility, this is critically important for the funding, but also critically important when we think about program design, because we want to design a program that grows and evolves as the needs of innovators change. And so in the case of One Family Health, we were really happy to be able to work with them as they tried to course correct and address some of the obstacles that have been in their way. So I'm just grateful that we've had the opportunity for the partnership, and now I want to turn it over to Sowmya, who's going to talk a little bit about innovations in healthcare.
Thanks, Jenny. Thanks, Lila. Imagine, as Lila described, living in a remote village where the nearest primary care clinic is hours away, with the only transportation being the public bus, which runs once every few hours. Imagine that your child is suddenly very sick, but your only choice is to wait for the next bus, wait for hours at the only primary care clinic in town, and miss at the very least one whole day of work, maybe more if you end up not meeting with your provider, or if you have to run back again to get tests and procedures done. Not ideal, but way too common in developing countries. We've made significant improvements through relying on traditional approaches, but these have not been nearly sufficient to ensure that every child and every individual gets access to healthcare when they need it. Innovations in Healthcare is a nonprofit at Duke that believes in improving in healthcare access by supporting the scale and sustainability of promising global health innovations. We also believe that to succeed in this mission, partnerships are key. Transformative partnerships across social enterprises, public health systems, private stakeholders, funders, policymakers, all of these are needed to ensure that we can eradicate health disparities. Being the evaluation partner to Pfizer Foundation on the GIG program, we've set up monitoring systems and evaluation tools that help us collect multidimensional indicators that help us to track and understand really what's going on in the ground and amplify and provide support to our innovators. We also share lessons learned, both from individual grantees and from the portfolio as a whole, and that helps us inform the foundation's grant-making strategy. We also keep the foundation abreast of all the ground realities that innovators are facing and garner the foundation's support to course correct and navigate inevitable challenges. In the case of One Family Health, we realized that relocating does not necessarily mean failure. Rather, it shows tenacity to create greater access to quality healthcare for Rwandans by finding a more suitable community in which to provide these services, as Odette did. When funders have a flexible funding strategy, the grantee is set up for success. That is a key part of what makes our funding, our support both interesting and important. The role that we play to connect both funder and grantee to, especially in turbulent circumstances, to foster a culture of resilience when circumstances require that course correction and require that flexibility. So by building partnerships, we've actually seen that our efforts are capable of creating lasting change and improvements even in difficult circumstances. Did that happen in the case of Odette? We can find out from Lila.
I'm happy to say that Odette's story ends really well. We relocated her clinic to a village called Rwanda, which was clearly in great need of health services. Odette's facility now sees 40 to 50 patients a day. She employs an administrative assistant and assistant nurses to help with the workload. One Family Health has seen a lot of challenges, and we could tell a lot of stories. I think that we're optimistic that our story will also end well, as we're well on our way toward achieving our goal of 500 clinics in Rwanda and achieving financial sustainability. And it's through learning about stories like this that we're going to get there, as well as having the support of really great partners. So I thank you also for the opportunity today, because we often focus on our organizational challenges, but we couldn't do any of this without our incredible franchisees. And I appreciate the opportunity to celebrate Odette and her entrepreneurial spirit, her incredible tenacity, and her commitment, above all, to the health and well-being of her patients. Thank you.